Okay, thank you. So I'm going to focus, of course, on cardiac arrhythmias, but I'd like to distill the conversation that we had yesterday to what I think is the really prime arrhythmia of interest. I think we could all agree that even if there were some signal that caffeine products might increase the risk for atrial fibrillation or PVCs, that could be easily addressed by recommending avoiding those products in those individuals. The real issue and the real problem that we need to address is sudden cardiac death, because that is not an entity that you get a second chance on most of the time. So, for that reason, I think we really ought to focus on that. And I'd like to reorient a little bit what I said yesterday in light of the Deputy Commissioner's comments earlier about reasonable certainty and how we look at the risk factors related to any exposure. So what I said yesterday in terms of caffeine and the general concept of arrhythmia risk was that there really was no data suggesting any elevation of risk. People who are not statisticians often don't like to look at statistics in detail, but I think it's really important here for us to understand the statistical basis for these kinds of statements. So the way these studies are generally done, you look at the amount of events in people who are exposed to a substance, and you compare those amount of events to the amount of events that occur in people who do not have an exposure to that substance. And you can then calculate an odds ratio and say the people exposed to the substance have either increased risk, decreased risk, or no difference in risk. Now, what's important about that is that no matter what you show, you develop what's called a 95% confidence interval. So let's say there was absolutely no difference between the risk of sudden cardiac death in those exposed to coffee, because those are our studies that we had yesterday, and those who were not exposed. And so we get an odds ratio of 1. And as I showed you, there are hundreds of thousands of people that have been studied, not all related to sudden cardiac death. But let's say we even have very tight confidence intervals so that the odds ratio ranges between 0.99 and 1.01, which would be extremely tight confidence intervals. Well, what that tells us is that there's up to a 1% increased risk of exposure of sudden cardiac death if you're exposed to caffeine versus not exposed to caffeine. And similarly, there could be a 1% protection against sudden cardiac death. And whenever we have, we're 95% sure that the risk is somewhere in that range. And the bottom line is that we can't be 100% sure that there is no risk. There's always going to be some risk. And the smaller the risk and the tighter the confidence intervals that we want, the larger the sample that we're going to need to prove that there is no risk. And those are realities that have to do with evaluating risk and reaching a standard of reasonable certainty. So I think it's an important, obviously important question for the FDA to consider is what is the reasonable certainty? So moving on to the topic of this morning, which is caffeine, the different items that are in coffee versus energy drinks. As noted, there is not a lot of data on the specific elements that are in energy drinks that show any increase, decrease, or any data at all on whether they are associated with sudden cardiac death. So the question is, how would one go about assessing this? And I think it's important, obviously, when there are observations, such as the report that Dr. Higgins referred to, that they be collected and that one looks at at these, and then does critical assessments whether the observations together create enough of a signal to suggest that there might be an association. And then if there's an association, is that a causal association? But right now, so that's, I think, the steps that I would go to try to assess this. I think it's also important to try to assess whether there are real potential mechanisms, items that one might identify that can be surrogate risks of marker. And one of the classic food supplements that was associated with sudden cardiac death are liquid protein diets. So those came out, people started using them, and it turns out that liquid protein diets cause QT prolongation and an increased risk of sudden cardiac death. But there was a clear mediator, electrophysiologic mediator for the increased risk of sudden cardiac death. And especially when you're talking about a very rare event, I mean, we know that there's been a lot of exposure to coffee, caffeine, and energy drinks. So you're talking about very, very rare events. It's nice to have some sort of surrogate marker that one can look at that is associated with the endpoint of interest. So that might be something that would be very important. And I think what you've heard a lot is that there's a lack of information. And I think yesterday the topic came up in poison control centers to try to get better information about exposures, about caffeine levels, about all sorts of other pieces of information that could potentially be useful to address this issue. So I think it's, at this point, seems to be a huge question whether any of these products do have individually or in interaction any increased risk. I think the level of increased risk is probably very small, otherwise it would already be detectable in the population. And I think if one is concerned about the small potential increase in risk related to sudden cardiac death, one has to come up with a strategy that would be able to address that very, very small increased risk.